Okay, it's 1 o'clock, so we'll get going then. And I just want to welcome everyone to our session on first responder health and well-being. This is part of a number of sessions that we've had on this very topic over the last few days in the conference, and I think there's some more coming. The presenters in this session will sort of build on what we've seen already. The first presenter is Dr. Kelly Hine, and she's a policing scholar at the Australian National University Centre for Social Research and Methods. Kelly's actually in the process of moving right now, so she's provided us with a video presentation, which I will share right now if I don't mess it up again. And we'll start with her. So.
My name is Dr. Kelly Hine, and I'm a policing researcher and lecturer at the Australian National University. My research focuses on frontline policing, those police-citizen encounters. More specifically, I examine the decision-making processes during police use of force encounters. But what I've been noticing within this research is the amount of officers who are getting hurt. So today I want to talk about some of the dangers that face our police officers, and in particular, assaults against police officers. So policing is a dangerous occupation. For example, in the UK, assault rates towards officers occur 12 times more than all other occupations. Policing also frequently occurs in the top 5 occupations for injuries and fatalities. And in Queensland, Australia, which is where I'm from, 22% of police officer deaths were due to an attack by a suspect. In the US, it's estimated that 50 officers are killed over a 5-year period. In the UK, it's estimated that 10 officers are killed. In Australia, it's estimated that 4 officers are killed over the same time period. So policing is a dangerous occupation, and our officers are being assaulted, which can have devastating impacts. This can have physical impacts, such as injuries, permanent disabilities, or even death. It can have psychological impacts, such as PTSD, anxiety, and depression, and police have ranked being physically attacked as one of the most significant stresses in their work. There can be organisational impacts, such as financial costs, low morale, a loss of wages, medical expenses, insurance claims, and a decrease in productivity. And this can all lead to a lack of public trust in the ability of police to protect the community and a breakdown in police-citizen relationships. So the impact of assaults towards officers can affect not only the officer and their colleagues, but also family, friends, and society more general. While most police assault research focuses on assaults by officers towards members of the public, we need to get a better understanding about assaults towards members of the police force in order to prevent assaults from occurring or find ways to better protect our officers. Within the policing research, there are relatively few studies that examine assaults against police officers, particularly in an Australian context. The majority of research that does examine the topic tends to derive from the US. However, both society and policing practices are very different in Australia to the US. Subsequently, policing patterns and trends may also differ between these countries. So there is a significant gap in the knowledge about assaults against police officers, despite its prevalence and sadly, the sometimes fatal consequences. More research is needed to gain a better understanding of the circumstances involving assaults against police, particularly in this Australian context, in order to inform best practices to reduce and prevent assaults against the police from occurring. So to start to get a sense of what's happening, I'm going to talk about some of my previous research. These are the ones that I mentioned before that started to highlight the prevalence of assaults towards officers. And then I'll talk about what we can start to take away from these studies and where to next. The first study examined police fatalities in Australia, which included officers who died as a result of an assault. This study provides insights into the most serious incidences of assaults against police. The second study examined Queensland police officers who sustained injuries during significant events. It provides some insights into the circumstances in which officers get hurt as a result of assaults. Finally, the third study examines suspect resistance in Australia. This study helps to provide insights into the circumstances of when suspects resist and why suspects might resist arrest. Before we get into each of the studies, I want to provide you with some context about policing in Australia. Australia is a big country, and as this map illustrates, it's almost as big as the United States. We tend to stick to the coastal regions. So this map depicts population density with the darker areas more densely populated. In fact, only 2% of our population lives outside of these darker areas in that large light landmass area that you see. We have just 8 policing agencies, one for each state and territory, and then the Australian Federal Police. To give you some comparison, our largest policing agency in terms of the number of sworn officers and the population that they police is the New South Wales Police Force. They have over 16,500 sworn officers. They police a population of over 8 million across over 300,000 square miles. The LAPD have almost half the number of officers and police half of the population across just a fraction of the area. And while the Met Police have double the number of police officers, they police about the same population, but again, across only a fraction of the area. So Australian policing is very different to other countries, not just in terms of geography, but also our police culture and societal beliefs are also quite different. This difference is perhaps best illustrated by the differences in police-citizen relationships in terms of compliance and satisfaction with police. For example, it is reported that Australia's biggest policing agencies, the New South Wales Police, has a customer satisfaction rating of 96%, which is similar to other Australian policing jurisdictions. Whereas the United States public indicated a favourable view towards police of only 64%, and that was in 2016. And we know that in more recent times, perhaps that police-citizen relationship has broken down a little bit further. So the first study I want to talk about examined police fatalities in Australia, which included officers who died as a result of an assault. This study provides insights into the most serious incidences of assaults against police. In this study, my colleagues and I conducted an analysis of all Australian police officer fatalities between 2002 and 2019, as recorded on the National Police Memorial Honour Roll. This website commemorates officers who have been killed on duty or died as a result of their duties. During this time, there were 39 Australian police fatalities recorded. While assaults on officers were not the most common form of fatalities, they still represented almost a third of all deaths as a result of their duties, which you can see here in yellow on the left. Fatal assaults always involve males and typically constables. All of the fatal assaults occurred in the 3 biggest policing jurisdictions, which also have the highest rate of crime, with the exception of one fatal shooting of an Australian Federal Police officer that occurred while he was on patrol in a high-risk area overseas. All of the assaults involved the perpetrator shooting the officer, with the exception of one case in which the officer was stabbed with a knife and another case in which the officer sustained a deep hand wound that turned into a staph infection while transporting a resisting prisoner. Of the fatal assaults, only one case reported the officer wearing a bulletproof vest. The remaining 3 incidences consisted of officers who were involved in seemingly low-risk activities such as traffic control. Overall, the findings from this study suggest that, despite being a relatively rare occurrence, serious assaults do occur that result in officer fatalities. These events tend to be extreme and violent occurrences. The second study examined Queensland police officers who sustained injuries during significant events. It provides some insights into the circumstances in which officers get hurt as a result of assaults. So this study came about when I was looking at police use of force situations in Queensland, and I started noticing just how often officers were getting hurt in these situations. In this study, my colleagues and I conducted an analysis of officer injuries using official data from the Queensland Police Significant Event Messaging System. Specifically, the study examined police citizen encounters that resulted in an injury, including assaults against police and non-compliant suspects. All cases analysed were serious incidences due to the nature of the reporting system that was utilised for the data analysis. The data consisted of 202 significant police citizen encounters in Queensland between February 17, 2009 and June 18, 2012. What I found was that almost half the officers in these encounters sustained an injury. Although such a high proportion may be due to the data focusing on significant events only and is not representative of general everyday policing encounters. These injuries ranged in type, but tended to represent that the injuries sustained were a consequence of suspects resisting, and the suspects were taking advantage of an opportunity to assault and lash out at the officers rather than planned attacks. For example, most of the time, officers were being kicked, punched, or headbutted, or bitten, scratched, and spat on. And there were also a group of events where officers experienced both of these two categories during the same event. There were, however, about 10% of officers who sustained injuries as a result of a weapon, such as being stabbed. However, there was nothing in the reports to indicate that these events were premeditated attacks, rather the results of opportunities taken by the suspect when resisting arrest. Officers who sustained injuries mostly occurred during already volatile situations or calls for service. Most of the times these were social disturbances such as domestic violence or disputes, and serious incidences such as serious assaults or armed persons. While about 26% of the officers sustained injuries during minor incidences such as vehicle intercepts. Additionally, officers sustained injuries about 6% of the time during incidences involving a person with mental illness or who was suicidal. Without going into details, I also conducted a logistic regression to identify predictors of officer injuries. What I found was that while certain situations and suspects may pose a level of dangerousness for officers, ultimately it was how an officer responds to the circumstances that best determined whether an officer sustained an injury. However, it should be noted that this does not indicate that officers should use more force, as the analysis did not find this to be a significant factor. Overall, this study highlights the prevalence of officers who sustain injuries as a result of assault against police or sustained by resisting suspects. While most of the injuries tended to be relatively minor, almost all injuries required hospital attendance. These findings suggest that these incidences tend to occur during already volatile situations, such as domestic disputes with physically aggressive suspects. So this third study examines suspects' resistance in Australia. And this study takes a look at the other side of the police-citizen encounter, that of the suspect, and it helps to provide insights into the circumstances of when suspects resist and why suspects might resist arrest. In this study, my colleagues and I focused on suspects who were charged with resisting arrest. The study utilised the Australian Institute of Criminology's Drug Use Monitoring in Australia, or DUMA, program to examine predictors of suspects who resisted arrest in terms of whether the suspect had been charged with resisting arrest or not. The data consisted of over 45,500 detainees between 2001 and 2012 at 11 Australian locations. So the results showed that 1 in every 14 police detainees in this study was charged with resisting arrest. Without going into too much detail, factors relating to offender demographics, crime, temporal, and policing district all contributed to whether suspects were charged with resisting arrest. Some of the key findings regarding offender demographics included age, marital status, and substance abuse. For age, the probability of being charged with resist arrest decreased such that the prevalence of resist arrest was lowest among older detainees. Resist arrest charges were more prevalent for detainees who were single, in terms of not married or not living in a de facto relationship. Resist arrest charges were disproportionately higher for detainees who had consumed illicit drugs in the 48 hours prior to the arrest. And finally, similar to the previous study, we also found that suspects who were charged with resisting arrest occurred more often in already volatile situations. It is also important to note that this study had many significant findings, not just related to the individual, but also for crime, situational, and temporal factors as well. But overall, these findings are indicative of the complex and multifaceted nature of police-citizen encounters. So what does this all mean, and what can we learn from these studies about assaults against police officers? These 3 studies provide some insights into potential strategies for policing agencies in the prevention and reduction of assaults towards police officers. These findings reveal the benefits and opportunities for the adoption of and enhancement of protective clothing. For example, the first study on fatal assaults found that in almost all of the recorded fatal shootings, only 1 case indicated that the officer was wearing a bulletproof vest, despite the officers being aware of the potential dangers prior to arriving at the scene. And prior research highlights the life-saving benefits of body-worn armour and, in turn, demonstrates the potential opportunity of enhancing policies and procedures that make body armour not only available to officers, but in also ensuring their use. And also the benefits of protective face shields. So the second study, which focused on injuries to officers, found that one of the most common forms of injuries was being spat on in the face. And this is concerning because all of these cases required testing for viral infections. And we also needed to consider all the added anxiety that that includes. COVID-19 has emphasised this concern, and many states and territories in Australia has introduced laws to deal with people deliberately spitting, sneezing and coughing on police, in perhaps a declaration about the seriousness and risk of spitting and just how common that is. But there's a fine line, and we also need to note the limitations of such protective equipment. For example, the body armour can negatively impact physical performance and may be perceived by members of the public as forceful and negative. So we need to explore protective equipment a little more and look for any enhancement both with the equipment itself and policy and procedures about wearing protective clothing. Secondly, the value of education and training in preparing officers for such dangerous encounters is emphasised in all 3 studies. In the injury studies, to address the physical nature of these encounters, training that specifically focuses on defence tactics and avoidance strategies, such as tactical withdrawal and proximity awareness training, may be beneficial in preventing injuries from occurring. Furthermore, the value of live action scenario-based training, such as tactile role-playing exercises that simulate real-world environments, is also emphasised. Moreover, the study highlights the opportunity and benefits of education programs that provide awareness and understanding of potentially dangerous situations. But we also need future research to look at the effectiveness of such education and training programs. Finally, the third study that examines suspect resistance suggests that suspects who resist may be best explained by risk perceptions and loss aversion theory. The study explained that loss aversion theory proposes that if a suspect has something greater to lose by being arrested, then they'll likely resist arrest. The findings from this study were discussed in terms of loss aversion theory in that younger detainees may be more willing to take risks. Married or offenders living in a de facto relationship may fear loss of a relationship if arrested. And offenders under the influence of illegal substances are likely to have impaired decision-making and fail to accurately assess risk and loss. Consequently, this study also highlights the importance of educating officers to be aware and mindful that certain circumstances may produce fear in suspects who perceive arrest to be a greater loss than resisting. Subsequently, the study states that one way to minimise this perception by suspects is to utilise procedural justice practices. The study suggests that community-orientated policing may serve to build relationships between at-risk communities and police before the incidences occur, as findings show that engaging with the community often leads to high level of confidence and trust in police. While there's an abundance of research on community-orientated policing and procedural justice practices from the US that indicate promising results, these policing strategies are not without their limitations. More research is needed about the effectiveness of these approaches in the Australian context. The dangers of policing are well reported within the occupational safety literature. with policing being recorded as one of the most dangerous occupations. Assaults against police can result in not only physical injuries, but can also have psychological, financial, and societal impacts. The consequences of assaults against police can be far-reaching, including family and friends, fellow officers, and society. The current body of knowledge about assaults against police is under-researched. Nonetheless, the current 3 studies have highlighted some opportunities for police in reducing or preventing members of the public's assaulting police.
Here we are. So that presentation actually serves very well to lead into Dr. Joseph Schaefer's research talking about the stresses of policing because assaults on police or the risk of assault on police is one of the major stressors for police. So I'm going to turn that over to Joe. Dr. Joseph Schaefer is a professor of criminology and criminal justice and an associate dean of research in the College of Public Health and Social Justice at St. Louis University. Joe, over to you.
All right. Well, thank you, Richard. And as Richard said, I think Dr. Hines' research is a good segue into the research I want to share with you this afternoon, looking more at the risks and damages officers may face emotionally, mentally, and their well-being in that regard. Now, I'll note at the onset, this is somewhat an initial analysis of the data that we have. And we're wanting this afternoon to cover a kind of a broad brush of what we did in the project I'll describe. So we're not going to have time, unfortunately, to go into as much depth as we might like to with some aspects of things. But along with my colleagues, we're looking at police officer stress, particularly in a high crime community in St. Louis, Missouri, and looking at the 3 themes we're trying to address in our project of the causes, the consequences, and the coping mechanisms that officers reported deploying. So my colleagues on this project that I want to acknowledge just at the front end are Jake Eikenberry and Donald Lindhorst. Don is a faculty member in the School of Social Work, and Jake is a PhD student. And our project, we want to note, is supported by the Door Center at St. Louis University. They provided, the center provided some resources to support this project. Now, if you've been attending other panels, I think it's not too shocking to say we know a decent amount at this point about causes, consequences, and coping mechanisms. There's more to learn, certainly, but in general terms, we have a decent understanding of these issues. We have some sense of the causes and consequences, what generates stress for officers, and the interplay we often see in studies and literature talking about the interplay between the politics and the internal aspects of the organization as stressors versus the dangers and the risks of police work as a potential stressor. We know then that a lot of the sources of stress tend to be, in most studies, officers report they're more stressed by internal issues, leadership and management decisions, perceptions of politics and favoritism within the organization. And we have a sense of the normative recommendations. We know what any number of, at least in the US government and police advocacy groups and professional associations would recommend to officers as coping mechanisms. But in looking at this kind of lay of the land with what we know, when Don and I started working on this project, we found ourselves saying, well, do these things hold in a community such as St. Louis? So St. Louis is among the many communities in this country that finds itself recovering from crisis and controversy. And our research and our data collection precedes the summer of 2020. And I'll explain some of the specific events in St. Louis that lead us to kind of categorize it as a community in recovery. We found ourselves wondering, do this notion that the primary stressors officers experience being internal, does that hold in a very disadvantaged community where officers are exposed to very high levels of trauma, even within the landscape of police personnel, experiencing, while we don't have quantitative data to prove it, I'll share some insights and some data points that certainly are suggestive that likely officers in St. Louis are probably at the leading edge among police patrol personnel in the country for the volume of trauma exposure that they have. So does the internal stress still sort of lead in that type of situation? And how do officers perceive the value of these normative recommendations that we see? So we set out to try to begin to answer these three questions. And the presentation this afternoon will try to give you sort of a quick and cursory answer to those three questions. Now, just to give you a little bit of context for those who may not be, I'm not sure how diverse the audience is in terms of geography and country of origin. St. Louis sits roughly in the middle portion of the United States. In the bottom right here, you have a map of the city and its major neighborhoods. The eastern boundary, the right-hand boundary of St. Louis is a hard boundary. That's the Mississippi River. St. Louis is a city of about 66 square miles. It's a depopulating community, so it's been losing population for the last 30 or 40 years. There's around 300,000 residents these days, fairly mixed demographically, roughly equal proportion of white and Black residents. It's policed by the St. Louis Metropolitan Police Department, which has an authorized strength of about 1,300, but it's well below that, as many urban areas are these days in the US. Heavily male organization, decent representation of Black officers, but not really quite in proportion with the general public. Now, why we would characterize St. Louis as being somewhat in crisis and recovery is St. Louis, while it was not immediately involved in the shooting of Michael Brown in Ferguson, Ferguson is just a few miles to the west-northwest of St. Louis, and so the city itself was not heavily focused. So if you see things that talk about the policing of the protests in Ferguson, the primary agency assisting Ferguson Police Department in that was the St. Louis County Police Department, which is a separate agency. But St. Louis City was not immune from those. And in 2017, there was a verdict related to a police officer in St. Louis, Officer Stockley, and it actually dated back to a 2011 shooting case in which Officer Stockley and his partner observed what they believed was a drug transaction. When they approached the person they believed had sold the narcotics, there were some shots fired, there was a brief vehicle pursuit, and ultimately the Officer Stockley's partner rammed the fleeing vehicle, and the citizen Anthony Smith was shot 5 times and fatally, with a fatal outcome by Officer Stockley, excuse me. And there was some controversy in the ultimate legal case that was brought. The case actually wasn't brought until 2016 against Officer Stockley, as to whether or not the implication was Officer Stockley may have planted a gun on Mr. Smith's body after the shooting. Ultimately, the verdict was Officer Stockley was acquitted in that situation. So as the community was recovering from the events of Ferguson in 2014 into 2015, 2017 places St. Louis seen an extended period of protests against the verdict in this particular case. St. Louis is also a very high crime community. There have been 40 homicides so far this year. 8 of those victims, importantly, are under the age of 17. I believe the youngest victim so far this year, unfortunately, had just turned 1. And that was not an accidental drive-by shooting caught in a crossfire situation. That presumptively was an intentional shooting of a 1-year-old, which is a pretty horrific statement to utter. And importantly, St. Louis sees a very high rate of gun violence in general. The homicide rate in recent years in St. Louis has been 10 to 12, 13 times the US national average, with hundreds and hundreds of additional non-fatal shooting events each year. So it's our position that officers in St. Louis are exposed to extremely high levels of violence and trauma. Now, to get into what we actually did then, we engaged in a qualitative study. We wanted to talk to officers in St. Louis about some of these issues. We had 2 informants who were St. Louis Metro PD officers, and they are participants. They are 2 of the 23 folks we interviewed, and they sort of served as informants and advocates and gatekeepers and connected us with other officers. We conducted with these 23 officers in-depth structured interviews. They ranged from about 45 minutes to around 90 minutes, depending on how talkative an officer was. We recorded and transcribed these interviews, and we're now working our way through the several hundred pages of resulting transcripts to do systematic qualitative coding. That is still in process, but what I'll share with you today is sort of a rough cut at some of the high themes and quotes that illustrate some of those things that we see. It's important to note our interviewees, we think we did a reasonable job approximating the demographics of the department. We're slightly more male. We only had 2 out of the 23 participants that were female. If we'd had 1 more female participant, we would have gotten a bit closer. In general, they had almost 12 years of service. That's partly intentional. We were wanting to look at the policing perceptions, the perceptions of officers pre-post Ferguson. So we intentionally wanted officers that had some time on the job before Ferguson. So we really focused on officers that had been on the job since around 2012, 2011 or earlier. Relatively well-educated group, half had a bachelor's degree or higher. Many were currently in specialized units, and that's common because of the years of service that they had. St. Louis Patrol is a young officer's game. So many of the people we talked to had worked their way into specialized units. So what were the causes, the consequences, and the coping strategies? And the green text you'll see here just is sort of the emphasis that I've added to some of the quotes just to kind of illustrate some of the major themes, and not probably much different than what we would expect to hear from a sample of urban police officers in any part of the United States. A sense that people hate them, stated a bit more colorfully than that in the officer's original language. That they see a lot of negative, that they see more in 6 months in terms of trauma and negative outcomes than most people see in their entire lifetime. How had that changed since Ferguson? One officer with 26 years on the job said, I was a lot happier working as an officer in St. Louis in the first 15 years I had on the job. This officer didn't immediately draw the distinction at Ferguson, said things had kind of been changing already, but said, I'm just trying to ride it out and hit 30 years. And that's kind of a good pension sweet spot for me. And that's my objective, is to hit that 30-year mark. It seems that a lot of the public were just hating cops. They think that you have some personal vendetta against them. Instead, you're just doing your job. And layered in with this is a manpower, a staffing issue. Officers would say, we're supposed to be 1,300 officers right now. Depending on the time you look at, the city is sitting closer to 1,000. So they're 20-25% understaffed. This creates a lot of additional compression on patrol officers, because a lot of that hits patrol even more so than specialized units, because the volume of calls doesn't go down with a reduction in staffing. Trauma experience is very high. While a single example, one officer reported going to 2 different homicide events with 3 homicide cases in a single 8-hour shift. So in the year prior to their interview, they had seen 3 homicide events in a single shift. I've seen a fair share of dead children, gunshot wounds to youngsters, things like that. And officers would talk about the difficulty of dealing with that. Officers would volunteer on their own, kind of their worst story, their worst thing they've seen, and it invariably involved violent crime, often with young children. And as well, similar to some of the things Dr. Hines' research illustrated, officers would talk about their own involvement in shootings. Everybody that we talked to knew an officer who had died in the line of duty, or an officer who had died in some other circumstances. Just prior to the beginning of our research project, there had been an incident where an on-duty officer was out of her assigned district socializing with a couple of officers who had just gone off duty. This was around 12:30 or 1 in the morning, and they were, for whatever reason, playing Russian roulette, and with a gun that they thought was unloaded, the on-duty officer was fatally shot accidentally by a coworker who was drinking and things like that. So everybody had a story to tell about knowing an officer who had been killed, who had been seriously injured. Many of the officers had been involved in shootings themselves. We didn't systematically ask that, but 3 officers volunteered the information that they had been involved in shootings. And we know at least one of the officers had themselves been shot and had gone through a very arduous recovery process to get back on duty. The trauma to which officers were exposed were not simply limited to homicides. One officer related a story, and I've tried to truncate it down. It's still fairly long here, but related a story of a robbery related to a drug debt where 2 gentlemen came in, kicked in the door, put a pistol to the dad's head. The dad apparently owed an amount of money for a drug debt. And this is in front of the father's 7 kids, all under the age of 11. The 2 gentlemen, the 2 robbers, decide they're going to take a relatively new washer and dryer, but still determine ultimately that's not enough. Try to say, you still owe us more than that. The dad offers some colorful language, says, I don't have anything else. And the officer said, they put a pistol to the 7-year-old's head and they're like, I'll bet you got the money now. And the oldest child, his 11-year-old daughter, brings them her piggy bank out of a sense of helplessness to know what to do. And so, and this was, as the officer was telling us this story, was clearly trauma this officer was carrying with them at this point in time. Now, there are other comments, and I've kept them out of here just for the sake of time, but there were a lot of comments about internal stressors. So I focused on these sort of external stressors because these seem more, while we have qualitative data, not quantitative data, thematically, they seem more prevalent than we would expect from prior literature. But there was a lot of comments officers had to say about leadership issues, management, decision-making, and things like that. So while I'm presenting a lot of job-related stressors, I do want to note that there were a lot of comments offered and a lot of stories told about internal stressors as well. And so the causes of stress in St. Louis seem to be a bit more of a balance of these job-related and internal circumstances. In terms of consequences, much of what we would expect to hear. Comments from officers about physical health. A lot of officers talked about periods of weight gain, periods of drinking to cope or to sleep or to unwind at the end of shifts. Many officers would relate this as being something that they'd struggled with earlier, and they now kind of had worked through that situation, and this was not necessarily a current coping mechanism. But officers would also talk about being able to easily see this in new coworkers, in younger coworkers, watching people gain weight in their first few years on the job, seeing young officers going out multiple nights a week after work to unwind with one another at the bar and things like that. A lot of comments about mental health consequences, as we would expect, the things that Dr. Hines' studies speak to, all of the things we've been hearing about all week, lots of issues with substance use disorders, alcohol and pills, lots of issues with PTSD and other types of stress-related consequences, insomnia, sleep disruptions, a lot of comments about relationship strife. Many of the officers talked about consequences that police work had had on their relationships, on their marriages, things of that nature. And again, we're qualitative, we're not quantitative. Is that more than what we would expect in a similar cross-section of the general public? We can't quite tease that out. We did try to, as I said, look at what had changed pre-post Ferguson and Stockley verdict, what had shifted in this community with these types of events. And officers felt like there was a big shift and that it was not a temporary effect, that there was an enduring shift in police work. And that was both in terms of how they felt the public was treating them and viewing them, and how they felt they were seeing their coworkers approach the job. So a lot of what we might refer to as depolicing, pulling back, avoiding doing the work. Some stories about officers, because of the protest with Ferguson or the Stockley verdict, quitting the job. Citizens responding more frequently now by You stop them, they throw a camera phone in your face and start belittling you and saying crazy things, presumably to try to bait an officer into some type of specific response. In terms of coping mechanisms, and I know we're running short on time here, and I want to make sure we do have some time for Q&A, so I'll try to wrap up here real quickly. Again, fairly similar to what we would expect to see, unfortunately. A lot of discussion about officers using alcohol, a lot of self-medication. There were several officers that talked about knowing coworkers that had begun to abuse prescription medications and substances as well. So it was not simply issues with alcohol, but seeing people that were abusing prescription medication. One officer talked at some length about the department and officers themselves contributing to that, not doing enough when they would see officers struggling with substance use disorders, whether that was alcohol or pills. And it was not, there were a number of officers that talked about knowing coworkers were showing up under the influence, were drinking or using on the job. So this was not simply an off-duty issue, but that this was an on-duty problem for a small, at least, subset of officers. And that the department, the coworkers tended to kind of cover up for that situation, not call it out, not challenge that situation. Relationships were characterized both as a negative, a source where their stress caused problems and strain on relationships, but also for some of the officers, it was characterized as a positive coping mechanism. So a number of officers talked about having a partner who was an ally, an asset, somebody they could talk to, somebody that would challenge them and call them out when they were in a low spot and let them know, look, things are piling up and you need to do something different about this situation. You're being snappy. You've been this way for a couple of weeks. We've got to, this isn't going to keep working. You've got to change this situation. What were the departmental responses? Well, as we often see in the policing literature, the St. Louis Metro PD has an employee assistance program. The acronym for that is PASS. Officers, we would ask them what they thought about it. And of the 23, only one had something kind of lukewarm to say about it. The other 22 were pretty caustic in their comments. It's worthless, it's a nightmare, it's horrible. I get the feeling they don't really care about officers, that they in that statement would be the available counseling and help staff. What officers tended to do for a coping mechanism instead is, while there were some comments suggesting that help seeking was stigmatized, what we actually saw in the second and third bullet point you have on the slide here was more typical, that officers actually encouraged and embraced counseling. That didn't necessarily mean that officers advertised or promoted to all of their coworkers, but officers didn't see a stigma in sharing with partners and friends that they were seeking assistance. They simply chose to do it outside of PASS. They would go into their own pocket. They would pay for it, not even copay. They would pay the entire cost of it out of their own pocket to avoid having it be something the department knew about. But it was not necessarily stigmatized. Officers talked about using prescription medication, seeking medication prescriptions to deal with anxiety and depression. They talked about when they found clinicians and providers that understood the needs of public safety personnel, sharing that information, advertising that fact with their coworkers. Very, very quickly, what are the implications? Policing and police officers are not monoliths, so we have variation in all of these themes, even with only a sample of 23 officers. While we see some expressions of stigma, what we see more strongly is a distrust of formal mechanisms and resources. And we do see a strong pattern of support for help-seeking behavior. But what was key was that help-seeking behavior needed to be clinicians and providers that officers felt understood police officers, understood the challenges and the trauma and the constraints that they faced. We still don't know a tremendous amount about the experiences of non-white male officers, and I think the literature in general, looking at police stressors, does a good job characterizing probably white male officers. We don't know as much about female officers and non-white officers, often even in quantitative studies, particularly for female officers, there's not enough to do a separate analysis. We would question whether we need to be sensitive as a research community to the possibility of intersectionality, that even within, outside of the realm of non-white male officers, white female and non-white female officers may have different experiences and coping strategies, and the research community hasn't yet been able to untangle that situation. We do see that in a community affected by crisis and controversy and trauma, that there are some distinctions with what we would expect to find in based on the prevailing literature. And we do see, as we would expect, a lot of implications here for the creation of better formal support methods. It's great that officers had somewhat destigmatized help-seeking behavior, but we believe it's less than ideal that officers are having to seek that help on their own through word of mouth and paying for it out of their own pocket. So I know we are tight on time. I apologize for that. But I am happy to answer questions, or you can reach out to me offline and I'll be happy to discuss our study further. Thank you.
Thank you very much, Joe. We do have one question, and it is, I'm interested in your thoughts on how we can change the tide and shift the culture of policing to address the issues you've raised in your presentations. I can say, just if I can, before I go to you, this is the sixth conference of the Law Enforcement Public Health, and a major theme of the conference for 5 of those 6 conferences has been the police and first responder mental health and well-being. So there's been some momentum with this, and it's been a topic for quite some time. We've seen some positive things happening, but it seems to be very slow. So anyway, I will, just with that, I'll turn to you to answer. I'll give your thoughts on that question.
Yeah, I think that's a great question. I mean, my personal view, and this is kind of a personal view, it's not based on any hard and fast empirical data, but I do think probably over the life cycle of a group like LEF, this is only my 2nd LEF conference, but from where I sit, the things I see, I do think that we are seeing a greater awareness and recognition, in the last decade, even in US law enforcement, of the need to be attentive to mental health needs, suicide risk and things like that. And I think that help seeking is very quickly becoming destigmatized in US policing. There's still progress to be made there, but I think, unlike other things we often talk about in policing literature, where we think of change being agonizingly slow, to me, this is something that is changing very, very quickly in far less than a single generation. So I think there's a lot of work that needs to be done. A lot of places with 18,500 agencies in the US, there's a lot of room to improve in some places, but I think there's also room for some optimism.
Yes, I will agree with that. And it's not just the U.S. I think this has become a major issue in a lot of the developed countries in the world. We've seen a little bit of that from Australia, but certainly it's a major issue. There was a very good session yesterday, and I think you were in on it, and it talked about training police officers as elite athletes. And if you have an opportunity for those attendees, go and look at the film or the video clip of that, recording of that, on the app website when it gets posted in a few days. That and a few of the other sessions are very informative and very good. But as you said, there's that growing recognition that something has to change and there has to be the proper support. Any other questions or comments? We're coming close to the end anyway. There was a lot of good information today. As I say, it feeds well into a lot of the other sessions that we've had, and your research is very key. Sadly, some of the things are not real surprises. So it is, that forms the basis, of course. Where do we go from here, and how do we make a real difference in coming up with something that's going to work and help people, not just police but other first responders as well. Any other quick questions? A last comment to you, Joe, if you want.
No, I just thank everybody for their patients and their participation and attendance, and hope everybody continues to have a great conference.
Yes, I agree 100%. Thank you very much for everyone, and we'll talk soon. Take care.